To wrap things up with the reproductive chapter, we need to go through STIs, or sexually transmitted infections. Now, you might have heard of these as STDs, or sexually transmitted diseases, or VDs as venereal diseases, but any of the three names, they're all the same thing. We're looking at infections of the genitalia. Now, this is the single most important case of what causes problems with reproduction. The reproductive disorders typically are coming from something based off of these STIs. Now, I'm not going to be showing the pictures here. If you really want to look at pictures of these, you can do a search. But just to save people some things they're looking at, we'll keep it to the words. Gonorrhea. Now, gonorrhea is going to be a bacterial infection. It can infect the reproductive tracts as well as the urinary tracts, actually. Now, this spread, as it makes sense, through sexual contact. So the genitalia will spread this, anal, as well as pharyngeal mucosa. So that's the pharynx can also have this. So basically, any of the mucosa, oral or anal or genital, can have transmission of gonorrhea. Now, I got to break down the symptoms and the signs of this, male versus female, because they have two different categorizations here. In the case of males, you're looking at painful urination, discharge of a pus-like solution coming out of the penis, looking at urethritis. Basically, you're going to know you have this. In females, interestingly enough, about 20% of all females are asymptomatic. They have no clue they even have this. Now, does that mean they can't spread it? No, they can still spread. So even if a female is asymptomatic, she can still spread this to her partners. But for the 80% that do have signs or symptoms, looking at abdominal discomfort, looking at vaginal discharge, looking at abnormal uterine bleeding. When I say abnormal, I mean it's not lining up with normal uterine cycle. So maybe it's mid-cycle, or it's heavier than normal, or it's several times throughout the cycle. Now, this can progress into pelvic inflammatory disease and potentially even into sterility in the female. So this aspect, gonorrhea, can progress into some very serious problems. Now, treatment is antibiotics. And for the most part, a regimen of antibiotics will get rid of gonorrhea. Although there are some that are starting to become antibiotic resistant, which means they need to find different antibiotics or try different things to get rid of gonorrhea. All right, next up is syphilis. Now, syphilis is also a bacterial infection. And with being bacterial, it means we do use antibiotics to get rid of it. But what the problem here is, if a female has syphilis and is pregnant, if that fetus becomes infected, typically that fetus either is stillborn or dies shortly after birth. Unfortunately, a developing fetus with syphilis just cannot really survive very easily. The infection, asymptomatic for about 2 or 3 weeks. That means after infection, 2 or 3 weeks, you have no idea that you even have it. And then a lot of times, painless canker appears. It's a little sore. And then that can just disappear. And it could be just discount of nothing much. But if untreated, secondary signs appear 3 to all the way up to 12 weeks later. These can appear with a rash on the skin, fever, and joint pain. Now you're saying, well, that doesn't sound very STI related, but that's what's occurring at this point. The latent period, so that's the period where you're not getting any symptoms, may or may not progress until tertiary syphilis. Tertiary, or the third stage of this case. So it may just stay latent, may progress on, depends on the person. But you have these gumas then, they'll appear in the tertiary stage. We're looking in the central nervous system, blood vessels, bones, are where all these lesions can appear. And if they are left unchecked there, lesions growing in the central nervous system really isn't good. But lesions, blood vessels, bones can also be equally problematic. So it depends on a case by case if it will progress to this level. Treatment, penicillin. So just the basic old penicillin typically can get rid of syphilis. Chlamydia. Now, chlamydia probably is the most common, 25 to 50% of diagnoses cases with pelvic inflammatory disease. So if someone is diagnosed with pelvic inflammatory disease, More often than not, up to half the times, it's based off of a chlamydia infection. This is by far the most common STI in the United States. So symptoms: urethritis, penile and vaginal discharge, abdominal, rectal, testicular pain. And basically, you're going to know this is a problem because you're going to have problems with intercourse as well. So pretty much all of the genitalia is getting involved in feeling that this is a problem. You can also have irregular menses as far as women go. So that one can cause it to either occur earlier, not occur. So you're looking off that 28-day cycle. Believe it or not, this can actually cause arthritis. So you're saying, well, arthritis? Yes, chlamydia itself can get into and cause arthritis. Can cause urinary tract infections in men. Can even cause sterility in women. So chlamydia can become very problematic if left unchecked. Treatments: tetracycline. So there are treatments that can help to reverse and get rid of chlamydia itself. Genital warts. Now, genital warts is caused by the human papillomavirus, the HPV, so human papillomavirus. What's interesting is this can be linked to an increased risk of cancer for the infected area. So if it was the penis for a male that was infected, that could cause increased risk of cancer in the genital area. And same thing for women in their genital areas. So genital warts is a virus. So now genital herpes also is a virus caused by the human herpes virus type 2, because there's a type 1. So genital herpes is human herpes virus type 2. Now in this case, you're looking at latent periods and flare-ups. There's no set time period. It's not like the flare-up lasts for 3 or 4 days and then the latent period is 2 weeks. It all depends on the person. The flare-up might last for 2 weeks. Latent period then might be a day or two and a flare-up again. There's different symptoms, different things that can trigger flare-ups of genital herpes. Now, congenital herpes can cause malformations of the fetus. So that fetus, if it picks this up from the mother, that can cause problems and malformations in that field development. Treatments: looking at acyclovir or other antiviral drugs, because it's a virus, so you can't just use antibiotics. Now, these antiviral drugs may or may not work. They may simply just prevent it from having flare-ups. Depends on the person, depends on each individual system. So a whole series of different STIs and some of their treatments and the different signs and symptoms.